Sexually transmitted diseases, or STDs, are a major public health issue affecting millions of people around the world each year. These infections are caused by bacteria, viruses, or parasites that are transmitted through sexual contact. The most common STDs include chlamydia, gonorrhea, syphilis, human papillomavirus, HPV, herpes, and HIV/AIDS. Each of these diseases has its own set of symptoms, complications, and treatments, but they all share the commonality of being preventable and treatable if detected early. Despite this, STDs continue to spread at alarming rates, partly due to a lack of awareness, education, and access to healthcare services. These diseases don't discriminate, impacting individuals of all ages, backgrounds, and walks of life, whether you are young or old, male or female, rich or poor. Sexually transmitted diseases can affect anyone who is sexually active. The stigma surrounding STDs often prevents people from seeking the help they need, leading to further spread and complications. It's important to understand that having an STD does not make someone a bad person. It simply means they need medical attention and support. Beyond the physical health repercussions, STDs often carry a heavy burden of social stigma and emotional distress. Many people feel ashamed or embarrassed about having an STD, which can lead to feelings of isolation and depression. This stigma can also prevent individuals from disclosing their status to sexual partners, further perpetuating the cycle of transmission. It's crucial to create a supportive and non-judgmental environment where people feel comfortable seeking help and discussing their sexual health openly. Many STDs show no symptoms, particularly in their early stages, making it crucial for anyone who is sexually active to be aware that they could be infected and could unknowingly transmit an infection to others. Regular testing is essential for early detection and treatment, which can prevent long-term health problems and reduce the spread of infections. It's important to have open and honest conversations with sexual partners about STDs and to practice safe sex by using condoms and other protective measures. Untreated STDs can lead to serious long-term health problems, including infertility, chronic pain, and an increased risk of certain cancers. For example, untreated chlamydia and gonorrhea can cause pelvic inflammatory disease, PID, in women, which can result in infertility and chronic pelvic pain. HPV is linked to cervical, anal, and throat cancers, while untreated syphilis can cause damage to the heart, brain, and other organs. Early detection and treatment are key to preventing these severe complications and maintaining overall health. It's not just about individual health either. STDs pose a significant burden on healthcare systems globally, with substantial costs associated with testing, treatment, and managing long-term complications. The financial strain on healthcare systems can be immense as resources are diverted to address the ongoing epidemic. This includes the cost of diagnostic tests, medications, hospitalizations, and long-term care for those with chronic conditions resulting from untreated STDs. Public health initiatives and education programs are essential to reduce the incidence of STDs and alleviate the pressure on healthcare systems. This emphasizes the need for proactive measures to prevent the spread of STDs and to ensure timely diagnosis and treatment. Education and awareness campaigns can play a significant role in informing the public about the risks of STDs and the importance of regular testing and safe sex practices. Vaccinations, such as the HPV vaccine, can also help prevent certain types of STDs and their associated complications. By taking responsibility for our sexual health and encouraging others to do the same, we can work together to combat the silent epidemic of sexually transmitted diseases. Community health workshops, school programs, and public health campaigns are vital in spreading awareness and providing education about STDs. These initiatives can help dispel myths and misconceptions about sexually transmitted diseases, reduce stigma, and promote healthy behaviors. Schools can play a crucial role by incorporating comprehensive sex education into their curricula, teaching students about the risks of STDs and how to protect themselves. Community health organizations can offer free or low-cost testing and treatment services, making it easier for individuals to access the care they need. Healthcare professionals play a critical role in the fight against STDs. Regular testing and early treatment are essential for preventing the spread of infections and reducing the risk of long-term health problems. Doctors, nurses, and other healthcare providers can offer valuable guidance and support to individuals at risk of or affected by STDs. They can also help educate patients about safe sex practices, the importance of regular testing, and the availability of vaccines and treatments. By working closely with healthcare professionals, individuals can take control of their sexual health and reduce the impact of STDs on their lives. Counseling and support services are also crucial for individuals affected by STDs. These services can help people cope with the emotional and psychological impact of an STD diagnosis, providing a safe space to discuss their feelings and concerns. Support groups and counseling sessions can offer encouragement and advice, helping individuals navigate the challenges of living with an STD. By addressing the emotional and mental health aspects of STDs, we can help individuals lead healthier, more fulfilling lives. Research and innovation are key to advancing our understanding of STDs and developing new treatments and vaccines. Scientists and researchers are continually working to find better ways to prevent, diagnose, and treat sexually transmitted diseases. This includes the development of new medications, vaccines, and diagnostic tools that can improve patient outcomes and reduce the spread of infections. By supporting research and innovation, we can make significant strides in the fight against STDs and improve public health worldwide. Policymakers and public health officials also play a crucial role in addressing the STD epidemic. By implementing evidence-based policies and programs, they can help reduce the incidence of STDs and improve access to testing, treatment, and prevention services. This includes funding for public health initiatives, support for comprehensive sex education, and the promotion of safe sex practices. Collaboration between government agencies, healthcare providers, and community organizations is essential to create a coordinated and effective response to the STD epidemic. The fight against STDs is a global effort requiring collaboration and cooperation between countries and international health organizations. Organizations such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, work together to develop guidelines share best practices and support countries in their efforts to combat STDs. By working together, we can address the global impact of sexually transmitted diseases and improve health outcomes for individuals around the world. Personal stories and experiences can be powerful tools in raising awareness and reducing stigma around STDs. By sharing their journeys, individuals affected by STDs can help others understand the importance of testing, treatment, and prevention. These stories can also provide hope and encouragement to those who may be struggling with an STD diagnosis, showing them that they are not alone and that support is available. By listening to and learning from these experiences, we can create a more informed and compassionate society. Community events and initiatives play a vital role in promoting sexual health and preventing STDs. These events can bring people together to learn about the risks of STDs, the importance of regular testing, and how to practice safe sex. They can also provide opportunities for individuals to access testing and treatment services, receive vaccinations, and connect with support groups and counseling services. By participating in and supporting these community initiatives, we can help reduce the spread of STDs and improve the overall health and well-being of our communities. Educational materials and resources are essential tools in the fight against STDs. Pamphlets, posters, and online content can provide valuable information about the risks of STDs, the importance of regular testing, and how to protect oneself and others. These materials can be distributed in schools, healthcare facilities, community centers, and online platforms, reaching a wide audience and raising awareness about sexual health. By making educational resources readily available, we can empower individuals to take control of their sexual health and make informed decisions. Open and honest conversations about sexual health are crucial for preventing the spread of STDs and reducing stigma. By talking openly with partners, friends, and family members, we can create a supportive environment where individuals feel comfortable discussing their sexual health and seeking help when needed. These conversations can also help dispel myths and misconceptions about STDs, promote safe sex practices, and encourage regular testing and treatment. By fostering open communication, we can work together to combat the silent epidemic of sexually transmitted diseases. Confidential and non-judgmental STD testing and treatment services are essential for encouraging individuals to seek help and get tested. Healthcare providers can create a safe and supportive environment where patients feel comfortable discussing their sexual health and receiving the care they need. By offering confidential services, healthcare providers can help reduce the fear and stigma associated with STDs, making it easier for individuals to access testing and treatment. This, in turn, can help reduce the spread of infections and improve overall public health. Public health campaigns play a crucial role in promoting the importance of regular STD testing and safe sex practices. These campaigns can reach a wide audience through various media channels, including television, radio, social media, and print materials. By raising awareness about the risks of STDs and the importance of regular testing and safe sex, public health campaigns can help reduce the incidence of infections and encourage individuals to take proactive measures to protect their sexual health. Vaccinations are a powerful tool in the fight against preventable STDs. The HPV vaccine, for example, can protect against the types of human papillomavirus that cause most cases of cervical cancer, as well as other cancers and genital warts. By receiving vaccinations, individuals can significantly reduce their risk of contracting certain STDs and their associated complications. Public health initiatives that promote and provide access to vaccinations can play a key role in reducing the spread of preventable STDs and improving overall public health. Regular checkups and screenings are essential for maintaining sexual health and preventing the spread of STDs. Healthcare providers can offer valuable guidance on how often individuals should be tested based on their risk factors and sexual behaviors. Regular screenings can help detect infections early, allowing for prompt treatment and reducing the risk of long-term health problems. By prioritizing regular check-ups and screenings, individuals can take control of their sexual health and reduce the impact of STDs on their lives. Community health centers play a vital role in providing access to free or low-cost STD testing and treatment services. These centers can offer a range of services, including diagnostic tests, medications, counseling, and support. By making these services accessible to all individuals, regardless of their financial situation, community health centers can help reduce the spread of STDs and improve overall public health. Public health initiatives that support and fund community health centers are essential for ensuring that everyone has access to the care they need. Educational workshops and seminars on sexual health and STD prevention can provide valuable information and resources to individuals of all ages. These events can cover a range of topics, including the risk of STDs, the importance of regular testing, safe sex practices, and how to access testing and treatment services. By participating in these workshops and seminars, individuals can gain a better understanding of their sexual health and learn how to protect themselves and others. Public health initiatives that offer and promote these educational opportunities are essential for reducing the spread of STDs and improving overall public health. Comprehensive sex education in schools is crucial for providing young people with the knowledge and skills they need to protect their sexual health. Public health officials and community leaders can advocate for the inclusion of comprehensive sex education in school curricula, ensuring that students receive accurate and age-appropriate information about STDs, safe sex practices, and the importance of regular testing. By educating young people about sexual health, we can help reduce the incidence of STDs and promote healthy behaviors from an early age. Online resources and telehealth services are becoming increasingly important for providing access to STD testing and treatment. These services can offer a convenient and confidential way for individuals to receive care, especially for those who may face barriers to accessing traditional healthcare services. Online platforms can provide information about STDs, offer virtual consultations with healthcare providers, and even facilitate at-home testing kits. By leveraging technology, we can make STD testing and treatment more accessible and reduce the spread of infections. Public health campaigns targeting high-risk populations are essential for reducing the spread of STDs. Young adults, LGBTQ+ individuals, and people with multiple sexual partners are often at higher risk of contracting STDs and may face unique challenges in accessing care. Tailored public health campaigns can address the specific needs and concerns of these populations, providing targeted information and resources to help them protect their sexual health. By focusing on high-risk populations, we can make significant strides in reducing the incidence of STDs and improving overall public health. The emotional and psychological impact of an STD diagnosis can be significant, and support and counseling services are crucial for helping individuals cope. These services can provide a safe space for individuals to discuss their feelings, receive guidance, and connect with others who may be going through similar experiences. By addressing the emotional and mental health aspects of STDs, we can help individuals lead healthier, more fulfilling lives and reduce the stigma associated with these infections. Reducing stigma around STDs is essential for encouraging individuals to seek help and get tested. Healthcare providers and public health officials can play a key role in challenging misconceptions and promoting a more compassionate and understanding approach to sexual health. By fostering a non-judgmental environment, we can help individuals feel more comfortable discussing their sexual health and accessing the care they need. Reducing stigma is a critical step in combating the silent epidemic of sexually transmitted diseases and improving overall public health. Community outreach programs focused on STD prevention and education can have a significant impact on public health. These programs can provide information, resources, and support to individuals who may be at risk of or affected by STDs. By engaging with communities and offering accessible services, outreach programs can help reduce the spread of infections and promote healthy behaviors. Public health initiatives that support and fund community outreach programs are essential for addressing the STD epidemic and improving overall public health. Funding for STD prevention and treatment programs is crucial for addressing the ongoing epidemic. Public health officials and community leaders can advocate for increased funding to support testing, treatment, education, and outreach efforts. By investing in these programs, we can reduce the incidence of STDs, improve access to care, and alleviate the burden on healthcare systems. Adequate funding is essential for ensuring that everyone has the resources they need to protect their sexual health and prevent the spread of infections. Sharing experiences with STD testing and treatment can help raise awareness about the importance of early detection and care. Personal stories can provide valuable insights and encouragement to others who may be hesitant to get tested or seek treatment. By highlighting the benefits of early detection and the availability of effective treatments, we can encourage more individuals to take proactive steps to protect their sexual health. These stories can also help reduce stigma and promote a more supportive environment for those affected by STDs. One of the biggest challenges in tackling STDs is the stigma that surrounds them. This stigma is deeply rooted in societal norms and misconceptions about sexual health. It often leads to feelings of shame, guilt, and embarrassment for those who are affected. The fear of being judged or ostracized can be so overwhelming that many individuals choose to remain silent about their condition. This silence, however, only perpetuates the problem, making it difficult to address the issue effectively. The stigma associated with STDs can also lead to discrimination in various aspects of life, including employment, relationships, and even access to healthcare. It's crucial to understand that STDs are medical conditions that require attention and care, just like any other health issue. By breaking down these barriers, we can create a more supportive and understanding environment for everyone. Many people hesitate to talk about sexual health, even with their healthcare providers. And this silence can prevent individuals from seeking timely testing and treatment. The reluctance to discuss sexual health can stem from a lack of education, cultural taboos, or personal discomfort. When individuals avoid these conversations, they miss out on valuable information and resources that could help them maintain their health. Healthcare providers play a crucial role in creating a safe and non-judgmental space for patients to discuss their concerns. By fostering open communication, providers can help patients feel more comfortable and empowered to take control of their sexual health. It's important to remember that healthcare providers are trained professionals who are there to help, not to judge. Encouraging open dialogue can lead to early detection and treatment, ultimately improving health outcomes. Open and honest conversations about sexual health are essential. These discussions can help dispel myths and misconceptions, provide accurate information, and promote healthy behaviors. When people feel comfortable talking about their sexual health, they are more likely to seek out testing, treatment, and preventive measures. Open communication can also strengthen relationships by fostering trust and understanding between partners. It's important to create an environment where people feel safe to express their concerns and ask questions without fear of judgment. This can be achieved through education, awareness campaigns, and supportive communities. By normalizing conversations about sexual health, we can reduce the stigma and encourage more people to take proactive steps in managing their health. We need to create a culture where people feel comfortable discussing their sexual health without shame or judgment. This involves challenging societal norms and stereotypes that contribute to the stigma surrounding STDs. Education and awareness are key components in changing these perceptions. Schools, workplaces, and community organizations can all play a role in promoting a more open and accepting attitude towards sexual health. Support groups and therapy sessions can provide a safe space for individuals to share their experiences and receive support from others who understand what they are going through. By fostering a culture of empathy and understanding, we can help individuals feel more confident in seeking the care they need. This includes educating young people about STDs and safe sex practices. Comprehensive sexual education programs can equip young people with the knowledge and skills they need to make informed decisions about their health. These programs should cover a wide range of topics, including the different types of STDs, their symptoms, modes of transmission, and prevention methods. it's important to provide accurate and up-to-date information that is relevant to the experiences of young people. By addressing these topics early on, we can help prevent the spread of STDs and promote a culture of responsibility and awareness. Educators, parents, and healthcare providers all have a role to play in ensuring that young people receive the information and support they need. It also means encouraging regular testing and breaking down the barriers that prevent people from accessing healthcare. Regular testing is a crucial component of STD prevention and management. Early detection can lead to timely treatment, reducing the risk of complications and transmission to others. However, many individuals face barriers to accessing testing and healthcare services. These barriers can include financial constraints, lack of transportation, fear of judgment, and limited availability of services. Healthcare providers and policymakers must work together to address these challenges and make testing more accessible to everyone. This can involve offering free or low-cost testing, expanding clinic hours, and providing mobile testing units. By removing these barriers, we can ensure that more people have the opportunity to take control of their sexual health. Another challenge is the lack of awareness about STDs. Many people are unaware of the prevalence of STDs and the risks they pose to their health. This lack of awareness can lead to complacency and risky behaviors. Public health campaigns and educational initiatives can play a vital role in raising awareness and providing accurate information about STDs. By highlighting the importance of prevention, testing, and treatment, we can encourage more people to take proactive steps in protecting their health. It's important to use a variety of platforms and approaches to reach different audiences, including social media, community events, and partnerships with local organizations. By increasing awareness, we can help reduce the spread of STDs and improve health outcomes for everyone. Many people are unaware of the risks, symptoms, and ways to protect themselves. This lack of knowledge can lead to misconceptions and risky behaviors. For example, some individuals may believe that they are not at risk for STDs if they are in a monogamous relationship or if they use contraception. However, it's important to understand that STDs can affect anyone, regardless of their relationship status or contraceptive use. Education and awareness are key to dispelling these myths and promoting safe practices. Providing clear and accurate information about the risks, symptoms, and prevention methods can empower individuals to make informed decisions about their health. This can include information on condom use, regular testing, and communication with partners. By increasing knowledge and awareness, we can help individuals take proactive steps to protect themselves and their partners. This lack of knowledge can have serious consequences, leading to delayed diagnosis and potential spread of infection. When individuals are unaware of the symptoms of STDs, they may not recognize the signs of an infection and delay seeking medical attention. This can result in the progression of the disease and an increased risk of complications. Additionally, individuals who are unaware of their infection may unknowingly transmit the disease to others. Early detection and treatment are crucial in preventing the spread of STDs and reducing the risk of complications. Healthcare providers play a key role in educating patients about the importance of regular testing and recognizing the symptoms of STDs. By providing clear and accurate information, providers can help patients take proactive steps in managing their health. We need to prioritize comprehensive sexual education that provides accurate and up-to-date information about STDs. Comprehensive sexual education programs should cover a wide range of topics, including the different types of STDs, their symptoms, modes of transmission, and prevention methods. These programs should be inclusive and culturally sensitive, addressing the diverse needs and experiences of different populations. It's important to provide information that is relevant and accessible to everyone, regardless of their age, gender, sexual orientation, or background. By prioritizing comprehensive sexual education, we can equip individuals with the knowledge and skills they need to make informed decisions about their health. This can lead to better health outcomes and a reduction in the spread of STDs. Educators, parents, healthcare providers, and policymakers all have a role to play in ensuring that comprehensive sexual education is a priority in our communities. This video aims to empower you with the knowledge you need to take control of your sexual health. We'll delve into the different types of STDs, discussing their causes, symptoms, and available treatments. We'll also explore effective prevention strategies, including safe sex practices and regular testing. Remember, knowledge is power. By understanding STDs, we can make informed decisions about our sexual health and contribute to a healthier future for ourselves and our communities. Let's break the silence and work together to stop the spread of STDs. In our journey to understand sexually transmitted diseases, we delve into a complex and often misunderstood realm of health. Sexually transmitted diseases, or STDs, are infections that are primarily spread through sexual contact. They can be caused by bacteria, viruses, or parasites. And each type presents its own set of challenges and health risks. Today we will focus on bacterial STDs, a category of infections that, despite being curable, continue to pose significant public health concerns. We first encounter a formidable foe bacterial STDs. These infections, caused by bacteria, are often silent invaders, lurking within the body without causing noticeable symptoms, especially in their early stages. This makes them particularly dangerous, as they can be unknowingly transmitted to others. Among the most prevalent bacterial STDs are gonorrhea, chlamydia, and syphilis. Gonorrhea, caused by the bacterium Neisseria gonorrhoeae, can infect the genital tract, rectum, and throat. Chlamydia, caused by Chlamydia trachomatis, is known for its ability to cause serious damage to a woman's reproductive system. Syphilis, caused by Treponema pallidum, progresses through stages and can lead to severe complications if not treated. Each of these infections poses unique threats to our health and well-being. Gonorrhea, for instance, can lead to pelvic inflammatory disease, PID, in women, which can cause permanent damage to the fallopian tubes, uterus, and surrounding tissues, leading to infertility. In men, gonorrhea can cause epididymitis, a painful condition of the ducts attached to the testicle that may lead to infertility if left untreated. Chlamydia, often called the silent infection due to its lack of symptoms, can also lead to PID in women and infertility in both men and women. Syphilis, if not treated, can progress to tertiary syphilis, affecting the heart, brain, and other organs, potentially leading to death. The good news is that bacterial STDs are generally curable with timely and appropriate antibiotic treatment. Antibiotics such as azithromycin, doxycycline, and ceftriaxone are commonly used to treat these infections. However, the rise of antibiotic resistance poses a growing challenge, making prevention and early detection more critical than ever. Antibiotic resistance occurs when bacteria evolve and develop the ability to defeat the drugs designed to kill them. This can happen through various mechanisms, such as genetic mutations or acquiring resistance genes from other bacteria. The misuse and overuse of antibiotics in both healthcare and agriculture have accelerated this process, leading to the emergence of superbugs that are difficult to treat. To combat the rise of antibiotic resistance, it is essential to use antibiotics responsibly and only when prescribed by a healthcare professional. Patients should complete the full course of treatment, even if they start feeling better, to ensure that all the bacteria are eliminated and to prevent the development of resistance. Additionally, healthcare providers should follow guidelines for prescribing antibiotics and consider alternative treatments when appropriate. Prevention is also a key strategy in the fight against bacterial STDs. Practicing safe sex, such as using condoms consistently and correctly, can significantly reduce the risk of transmission. Regular screening and testing for STDs, especially for sexually active individuals and those with multiple partners, are crucial for early detection and treatment. Education and awareness campaigns can help inform the public about the risks of bacterial STDs and the importance of prevention and early intervention. In conclusion, bacterial STDs are a significant public health concern that requires a multifaceted approach to address. While they are generally curable with antibiotics, the rise of antibiotic resistance underscores the need for responsible antibiotic use, prevention, and early detection. By understanding the risks and taking proactive measures, we can protect our health and well-being and reduce the impact of these infections on our communities. Gonorrhea, often referred to as the clap, is a sexually transmitted infection that has been known to humanity for centuries. Despite advances in medical science, it remains a significant public health challenge due to its highly contagious nature and the ability of the Bacterium, Neisseria gonorrhoeae, to adapt and develop resistance to antibiotics. This adaptability makes it a formidable opponent in the fight against sexually transmitted infections. The bacterium Neisseria gonorrhoeae is a gram-negative diplococcus, meaning it has a unique structure that allows it to thrive in the warm, moist areas of the reproductive tract. This includes the cervix, uterus, and fallopian tubes in women, and the urethra in both men and women. It can also grow in the mouth, throat, eyes, and anus, making it a versatile pathogen capable of causing a wide range of infections. One of the most insidious aspects of gonorrhea is its ability to spread silently. Many individuals infected with gonorrhea, particularly women, may not exhibit any symptoms at all. This asymptomatic nature means that the infection can be transmitted to sexual partners unknowingly, perpetuating the cycle of infection. The silent spread of gonorrhea is a major public health concern because it can lead to widespread transmission before the infection is even detected. When symptoms do appear, they can be easily mistaken for other conditions, leading to delayed diagnosis and treatment. For example, the symptoms of gonorrhea can be similar to those of a urinary tract infection or a yeast infection in women, and to those of a bladder infection or prostatitis in men. This can result in individuals not seeking medical attention promptly, allowing the infection to progress and potentially cause serious complications. In men, gonorrhea may manifest as a burning sensation during urination, which can be quite severe and uncomfortable. There may also be a discharge from the penis, which can vary in color from white to yellow or green. This discharge is often accompanied by a foul odor. Additionally, men may experience testicular pain or swelling, which can be a sign of a more serious infection that requires immediate medical attention. Women, on the other hand, may experience a range of symptoms that can be easily overlooked or attributed to other conditions. These symptoms can include an unusual vaginal discharge, which may be watery, creamy, or slightly green. Pain during urination is another common symptom, as is pelvic pain, which can range from mild discomfort to severe cramping. Some women may also experience bleeding between periods or after sexual intercourse, which can be a sign of a more advanced infection. However, it's crucial to remember that the absence of symptoms doesn't rule out infection. Many individuals with gonorrhea may not experience any symptoms at all, particularly in the early stages of the infection. This asymptomatic nature means that regular screening and testing are essential for sexually active individuals, especially those with multiple partners or those who do not consistently use condoms. If left untreated, gonorrhea can lead to serious health problems. In women, one of the most severe complications is pelvic inflammatory disease, or PID. PID is an infection of the female reproductive organs that can cause chronic pelvic pain, damage to the fallopian tubes, and infertility. It can also increase the risk of ectopic pregnancy, a life-threatening condition where a fertilized egg implants outside the uterus, usually in a fallopian tube. In men, untreated gonorrhea can lead to epididymitis, a painful inflammation of the epididymis, the tube that carries sperm from the testicles. Epididymitis can cause severe pain and swelling in the testicles, and if left untreated, can result in infertility. Additionally, gonorrhea can spread to the bloodstream and cause disseminated gonococcal infection, DGI, a rare but serious condition that can lead to joint pain, skin lesions, and inflammation of the heart, brain, or spinal cord. Diagnosing gonorrhea typically involves a combination of clinical evaluation and laboratory testing. Healthcare providers may collect samples from the affected areas, such as the cervix, urethra, rectum, or throat, depending on the patient's symptom and sexual history. These samples are then tested for the presence of Neisseria gonorrhoeae using various methods, including nucleic acid amplification tests, NATs, which are highly sensitive and specific. Treatment for gonorrhea usually involves a course of antibiotics. However, the increasing prevalence of antibiotic-resistant strains of Neisseria gonorrhoeae has made treatment more challenging. The Centers for Disease Control and Prevention, CDC, currently recommends dual therapy with 2 antibiotics, typically ceftriaxone and azithromycin, to ensure the infection is effectively eradicated. It's crucial for patients to complete the full course of antibiotics, even if symptoms resolve, to prevent the development of resistance. Preventing gonorrhea involves practicing safe sex, including the consistent and correct use of condoms, reducing the number of sexual partners, and engaging in regular screening and testing. Open communication with sexual partners about STI status and history is also essential for those at higher risk, such as individuals with multiple partners or those in communities with high rates of gonorrhea. More frequent testing may be recommended. Public health campaigns and education play a vital role in raising awareness about gonorrhea and other sexually transmitted infections. These efforts aim to inform individuals about the risks, symptoms, and importance of testing and treatment. By increasing awareness and reducing stigma, public health initiatives can encourage more people to seek testing and treatment, ultimately reducing the spread of gonorrhea. Ongoing research and development are crucial in the fight against gonorrhea. Scientists are continually working to develop new antibiotics and alternative treatments to combat antibiotic-resistant strains of Neisseria gonorrhoeae. Additionally, efforts are being made to develop vaccines that could provide long-term protection against gonorrhea, potentially reducing the incidence of this infection worldwide. Community health clinics and resources are essential in providing accessible and affordable testing and treatment for gonorrhea and other STIs. These clinics often offer confidential services, making it easier for individuals to seek care without fear of judgment or stigma. By providing education, testing, and treatment, community health clinics play a critical role in controlling the spread of gonorrhea and improving public health outcomes. Personal stories and testimonials from individuals who have experienced gonorrhea can also be powerful tools in raising awareness and reducing stigma. Hearing from those who have navigated the challenges of diagnosis, treatment, and recovery can provide valuable insights and encourage others to seek care. These stories can also highlight the importance of regular testing and safe sex practices in preventing the spread of gonorrhea. The global impact of gonorrhea is significant, with millions of new cases reported each year. The World Health Organization, WHO, estimates that there are approximately 87 million new cases of gonorrhea annually worldwide. This high prevalence underscores the need for continued efforts in prevention, testing, treatment, and research to combat this persistent public health challenge. Future directions in gonorrhea research include the development of rapid diagnostic tests that can provide results in minutes, allowing for immediate treatment. Researchers are also exploring the potential of using bacteriophages, viruses that infect and kill bacteria, as a novel treatment for antibiotic-resistant gonorrhea. Additionally, advancements in genomics and molecular biology are providing new insights into the mechanisms of antibiotic resistance, paving the way for more effective treatments. The importance of sexual health education cannot be overstated. Comprehensive sexual health education programs that include information about STIs, safe sex practices, and the importance of regular testing can empower individuals to make informed decisions about their sexual health. By providing accurate and age-appropriate information, these programs can help reduce the incidence of gonorrhea and other STIs. Collaboration between healthcare providers and public health organizations is essential in the fight against gonorrhea. By working together, these entities can develop and implement effective strategies for prevention, testing, and treatment. This collaboration can also facilitate the sharing of data and resources, leading to more coordinated and comprehensive public health responses. Technology also plays a crucial role in STI prevention and treatment. Mobile health applications and telemedicine services can provide individuals with easy access to information, testing, and treatment options. These technologies can also facilitate communication between patients and healthcare providers, making it easier for individuals to seek care and manage their sexual health. Addressing stigma and discrimination associated with gonorrhea and other STIs is vital for improving public health outcomes. Stigma can prevent individuals from seeking testing and treatment, leading to undiagnosed and untreated infections. Public health campaigns that promote understanding and acceptance can help reduce stigma and encourage more people to take proactive steps in managing their sexual health. The importance of regular STI screening cannot be emphasized enough. Regular screening allows for early detection and treatment of gonorrhea and other STIs, reducing the risk of complication and transmission. Healthcare providers should encourage their patients to undergo regular screening, especially those at higher risk, and provide information on where and how to get tested. Support networks and resources for individuals with gonorrhea can provide valuable assistance and guidance. These networks can offer emotional support, information on treatment options, and advice on managing the infection. By connecting individuals with others who have had similar experiences, support networks can help reduce feelings of isolation and empower individuals to take control of their sexual health. In conclusion, gonorrhea remains a significant public health challenge due to its highly contagious nature and the ability of Neisseria gonorrhea to develop antibiotic resistance. However, through continued efforts in prevention, testing, treatment, and research, we can combat this infection and reduce its impact on individuals and communities. It is essential for everyone to practice safe sex, undergo regular screening, and seek prompt treatment if infected. By working together, we can make strides in controlling the spread of gonorrhea and improving sexual health for all. Recognizing the symptoms of gonorrhea is crucial for early detection and treatment. Gonorrhea, a common sexually transmitted infection, can have serious health consequences if left untreated. Understanding the signs and symptoms is the first step in preventing its spread and ensuring timely medical intervention. While many individuals may not experience any noticeable signs, it's essential to be aware of the potential indicators. Gonorrhea can often be asymptomatic, especially in its early stages, which makes it even more important to stay informed and vigilant. Regular screenings and being attentive to any changes in your body can make a significant difference. For men, common symptoms include a burning sensation or pain during urination, a white, yellow, or green discharge from the penis, and pain or swelling in the testicles. These symptoms can be uncomfortable and alarming, but recognizing them early can lead to prompt treatment and prevent further complications. It's important to note that these symptoms can vary in intensity and may not all be present at once. These symptoms usually appear within a week of infection, but can take up to 30 days to manifest. The incubation period for gonorrhea can vary, and during this time, the infection can still be transmitted to others. This is why regular testing and being aware of your sexual health status is crucial, even if you don't have any symptoms. Women often experience milder symptoms, making it even more challenging to detect gonorrhea. The subtlety of these symptoms can lead to delays in seeking medical attention, which can result in more severe health issues down the line. It's important for women to be proactive about their sexual health and to seek medical advice if they notice any unusual changes. These symptoms may include increased vaginal discharge, a burning sensation during urination, vaginal bleeding between periods, and pelvic or lower abdominal pain. These signs can often be mistaken for other conditions, which is why it's essential to consult a healthcare professional for an accurate diagnosis. Early detection and treatment can prevent serious complications, such as pelvic inflammatory disease, which can lead to infertility. Regular STD screenings are a vital part of maintaining sexual health. They help in the early detection of infections like gonorrhea, even when symptoms are not present. Healthcare professionals recommend that sexually active individuals get tested regularly, especially if they have multiple partners or engage in unprotected sex. Early detection through screenings can prevent the spread of the infection and reduce the risk of complications. Open communication with your partner about sexual health is also crucial. Discussing your sexual history, getting tested together, and being honest about any symptoms can help in preventing the spread of gonorrhea and other STDs. Trust and transparency in a relationship can lead to better health outcomes for both partners. Educating yourself about gonorrhea and other STDs is an important step in recognizing the signs and taking appropriate action. Reliable sources of information, such as healthcare websites and medical professionals, can provide accurate and up-to-date knowledge about symptoms, prevention, and treatment options. Being well informed empowers you to make better decisions about your health. If you suspect you may have gonorrhea or have been exposed to it, it's important to seek medical advice promptly. Making an appointment with a healthcare provider for testing and consultation is the best course of action. Early diagnosis and treatment can prevent the infection from causing more serious health issues and reduce the risk of transmission to others. Treatment for gonorrhea typically involves antibiotics, which are effective in clearing the infection. It's important to follow the prescribed treatment plan and complete the full course of medication. Even if symptoms improve, before finishing the antibiotics. This ensures that the infection is fully eradicated and reduces the risk of developing antibiotic-resistant strains of gonorrhea. Adhering to the treatment plan is crucial for recovery. If you have any questions or concerns about the medication, don't hesitate to ask your healthcare provider. They can provide guidance on how to take the medication correctly and what to do if you experience any side effects. Practicing safe sex is one of the most effective ways to prevent gonorrhea and other STDs. Using condoms consistently and correctly can significantly reduce the risk of transmission. It's also important to have open and honest conversations with your sexual partners about safe sex practices and STD prevention. While there is currently no vaccine for gonorrhea, staying up to date with other vaccinations such as the HPV vaccine can help protect your overall sexual health. Research is ongoing to develop a vaccine for gonorrhea, which could provide an additional layer of protection in the future. Maintaining a healthy lifestyle can also support your immune system and overall well-being. Regular exercise, a balanced diet, and adequate sleep can help your body fight off infections and recover more quickly if you do contract an STD. If you have been diagnosed with gonorrhea, seeking support from friends, family, or support groups can be beneficial. Sharing your experience and receiving emotional support can help you cope with the diagnosis and treatment process. Remember, you are not alone, and there are resources available to help you through this time. Recognizing the signs of gonorrhea and taking proactive steps to address your sexual health can lead to better outcomes and a healthier future. By staying informed, getting regular screenings, practicing safe sex, and seeking medical advice when needed, you can protect yourself and your partners from the potential consequences of gonorrhea and other STDs. Education and awareness are key components in the fight against gonorrhea. Healthcare providers play a crucial role in educating patients about the importance of recognizing symptoms, getting tested, and following treatment plans. By working together, we can reduce the prevalence of gonorrhea and promote better sexual health for everyone. Community health initiatives and events can also raise awareness about gonorrhea and other STDs. Participating in these events and spreading the word about the importance of sexual health can help create a more informed and proactive community. Together, we can make a difference in preventing the spread of gonorrhea and ensuring that everyone has access to the information and resources they need to stay healthy. Taking control of your sexual health can bring peace of mind and a sense of empowerment. Regular testing, open communication, and safe sex practices are all part of a comprehensive approach to maintaining your health and well-being. By recognizing the signs of gonorrhea and taking action, you can protect yourself and your partners from the potential risks associated with this infection. In conclusion, recognizing the signs of gonorrhea is a critical step in ensuring early detection and treatment. By staying informed, getting regular screenings, and practicing safe sex, you can reduce the risk of infection and promote better sexual health for yourself and your community. Remember, your health is in your hands, and taking proactive steps today can lead to a healthier tomorrow. Stay informed. Stay healthy. Your awareness and actions can make a significant difference in your life and the lives of those around you. Thank you for taking the time to learn about recognizing the signs of gonorrhea and for being proactive about your sexual health. Together, we can create a healthier and more informed community. For more information, visit healthcare website. Here, you can find additional resources, educational materials, and support to help you stay informed and take control of your sexual health. Thank you for watching and take care. The good news is that gonorrhea is treatable with antibiotics. This means that with the right medical intervention, individuals who contract this sexually transmitted infection can be cured. Antibiotics work by targeting the bacteria responsible for the infection, effectively eliminating it from the body. However, it is important to understand that the success of the treatment depends on several factors, including the timely diagnosis and adherence to the prescribed medication regimen. Early detection and prompt treatment can prevent the infection from causing more serious health issues, such as pelvic inflammatory disease in women or epididymitis in men, which can lead to infertility if left untreated. However, the choice of antibiotics and the duration of treatment may vary depending on the severity of the infection and the presence of any antibiotic resistance. Antibiotic resistance occurs when the bacteria that cause gonorrhea develop the ability to defeat the drugs designed to kill them. This can happen when antibiotics are overused or misused, making it more challenging to treat the infection. In recent years, there has been a growing concern about the emergence of antibiotic-resistant strains of gonorrhea, which has made it necessary for healthcare providers to stay updated on the latest treatment guidelines and recommendations. In some cases, a combination of antibiotics may be required to effectively treat the infection and prevent the development of resistance. It's crucial to follow your healthcare provider's instructions carefully and complete the entire course of antibiotics, even if your symptoms improve before finishing the medication. Stopping the medication early can result in the bacteria not being fully eradicated, which can lead to a recurrence of the infection and increase the risk of developing antibiotic resistance. Your healthcare provider will provide specific instructions on how to take the medication, including the dosage and duration of treatment. It is important to take the medication at the same time each day and avoid missing doses. If you experience any side effects or have concerns about the medication, be sure to discuss them with your healthcare provider. This helps ensure that the infection is completely eradicated and reduces the risk of antibiotic resistance. By completing the full course of antibiotics, you are giving your body the best chance to fully recover and prevent the spread of the infection to others. It is also important to inform your sexual partners about the infection so that they can get tested and treated if necessary. This helps to break the chain of transmission and reduce the overall prevalence of gonorrhea in the community. In addition to taking antibiotics, it is important to follow up with your healthcare provider to ensure that the infection has been fully cleared. This may involve additional testing to confirm that the bacteria are no longer present in your body. Prevention is always better than cure. While antibiotics can effectively treat gonorrhea, taking steps to prevent the infection in the first place is the best approach. This involves practicing safe sex, getting regular screenings, and being aware of the signs and symptoms of gonorrhea. Educating yourself and your partners about the risks and prevention methods can go a long way in reducing the spread of this infection. Public health initiatives and awareness campaigns also play a crucial role in promoting safe sexual practices and encouraging individuals to seek medical care if they suspect they have been exposed to an STD. By prioritizing prevention, we can reduce the incidence of gonorrhea and other sexually transmitted infections, ultimately improving public health outcomes. Practicing safe sex by using condoms consistently and correctly is the most effective way to prevent gonorrhea and other STDs. Condoms act as a barrier that prevents the exchange of bodily fluids during sexual activity, thereby reducing the risk of transmitting or contracting infections. It's important to use condoms every time you have sex, whether it is vaginal, anal, or oral. Make sure to use a new condom for each act of intercourse and follow the instructions on the packaging to ensure proper use. In addition to condoms, other barrier methods such as dental dams can be used to reduce the risk of infection during oral sex. While no method is 100% effective, using condoms consistently and correctly can significantly lower your risk of contracting gonorrhea and other STDs. Regular testing is also crucial, especially for those who are sexually active with multiple partners or have a new partner. Getting tested for STDs, including gonorrhea, allows for early detection and treatment, which can prevent complications and reduce the risk of spreading the infection to others. Many STDs, including gonorrhea, can be asymptomatic, meaning that individuals may not show any signs or symptoms, but can still transmit the infection to their partners. Regular testing helps to identify these silent infections and ensure that they are treated promptly. It is recommended to get tested at least once a year or more frequently if you have multiple partners or engage in high-risk sexual behaviors. Testing is a simple and confidential process that can be done at the healthcare provider's office, a sexual health clinic, or through at-home testing kits. By staying informed about your sexual health and getting tested regularly, you can take control of your health and protect yourself and your partners from STDs. Chlamydia, another bacterial STD, is one of the most common sexually transmitted infections worldwide. This infection is caused by the bacterium Chlamydia trachomatis, which is a microscopic organism that can have a significant impact on human health. The prevalence of chlamydia is a global concern affecting millions of people across different continents and demographics. Despite its widespread nature, many people remain unaware of the risks and consequences associated with this infection. Caused by the bacterium Chlamydia trachomatis, this infection is particularly insidious because it often goes unnoticed. The bacterium is adept at evading the immune system, allowing it to persist in the body without causing immediate symptoms. This stealthy nature makes chlamydia a silent threat, capable of causing significant damage before it is detected. This infection often flies under the radar, as it frequently causes no symptoms, particularly in its early stages. Many individuals who are infected with chlamydia may not realize they have the infection, as the symptoms can be very mild or completely absent. This lack of symptoms can lead to a false sense of security, causing people to unknowingly spread the infection to others, as it frequently causes no symptoms, particularly in its early stages. When symptoms do appear, they can be subtle and easily mistaken for other conditions. Common symptoms of chlamydia include abnormal genital discharge, burning sensation during urination, and pain during sexual intercourse. However, these symptoms are not unique to chlamydia and can be attributed to other infections or health issues, making it difficult to diagnose without proper testing. They can be subtle and easily mistaken for other conditions. This often leads to delayed diagnosis and treatment, as individuals may not seek medical attention until the infection has progressed. The similarities between chlamydia symptoms and those of other conditions, such as urinary tract infections or yeast infections, can further complicate the diagnostic process. This often leads to delayed diagnosis and treatment, increasing the risk of complications and further transmission. The longer chlamydia remains untreated, the greater the potential for serious health consequences. Delayed treatment can result in the infection spreading to other parts of the body, causing more severe symptoms and increasing the likelihood of long-term health issues, increasing the risk of complications and further transmission. Chlamydia can be easily transmitted through sexual contact, including vaginal, anal, and oral sex. The infection can also be passed from mother to child during childbirth, leading to complications for the newborn. The ease of transmission and the often asymptomatic nature of the infection contribute to its widespread prevalence. Chlamydia can have serious implications for reproductive health, particularly in women. The infection can cause damage to the reproductive organs, leading to complications such as pelvic inflammatory disease, PID. PID is a serious condition that can result in chronic pelvic pain, infertility, and an increased risk of ectopic pregnancy, where a fertilized egg implants outside the uterus. Untreated chlamydia can lead to pelvic inflammatory disease, or PID, which can cause chronic pelvic pain, infertility, and ectopic pregnancy. The progression from chlamydia to PID can occur over a period of months or even years, with the infection causing gradual damage to the reproductive organs. Early detection and treatment of chlamydia are crucial in preventing the development of PID and its associated complications. In men, chlamydia can cause epididymitis, leading to pain, swelling, and potential infertility. Epididymitis is an inflammation of the epididymis, a tube located at the back of the testicles that stores and carries sperm. The infection can cause significant discomfort and, if left untreated, can result in permanent damage to the reproductive system, affecting a man's ability to father children, leading to pain, swelling, and potential infertility. The symptoms of epididymitis can include testicular pain, swelling, and tenderness, as well as fever and chills. These symptoms can be severe and may require medical intervention to manage. Early diagnosis and treatment of chlamydia are essential in preventing the development of epididymitis and preserving reproductive health. The immune system plays a crucial role in responding to chlamydia infection. When the body detects the presence of the bacterium, it mounts an immune response to try to eliminate the infection. However, the immune system's response can also cause inflammation and tissue damage, contributing to the symptoms and complications associated with chlamydia. Accurate diagnosis of chlamydia requires laboratory testing. There are several types of tests available, including nucleic acid amplification tests, NAATs, which are highly sensitive and specific for detecting chlamydia. These tests can be performed on urine samples or swabs from the affected area, such as the cervix, urethra, or rectum. Early and accurate diagnosis is essential for effective treatment and preventing the spread of the infection. Chlamydia is treatable with antibiotics. The most commonly prescribed antibiotics for chlamydia are azithromycin and doxycycline. These medications are effective in eliminating the infection and preventing complications. It is important for individuals diagnosed with chlamydia to complete the full course of antibiotics as prescribed, even if symptoms resolve before the medication is finished. Preventing chlamydia involves practicing safe sex and regular screening. Using condoms consistently and correctly can significantly reduce the risk of transmission. Regular screening for sexually transmitted infections, STIs, is also important, especially for sexually active individuals with multiple partners or those in high-risk groups. Open communication with sexual partners and healthcare providers about sexual health is essential for preventing and managing chlamydia. Education and awareness are key to reducing the prevalence of chlamydia. Public health campaigns and educational programs can help inform people about the risks, symptoms, and prevention strategies for chlamydia. Increasing awareness and understanding of the infection can encourage individuals to take proactive steps to protect their health and seek medical attention if they suspect they may have been exposed to chlamydia. Access to healthcare services is crucial for managing chlamydia. Community health clinics and other healthcare providers play a vital role in offering testing, treatment, and education about chlamydia and other STIs, ensuring that individuals have access to affordable and confidential healthcare services can help reduce the spread of chlamydia and improve overall public health outcomes. Chlamydia affects people of all ages, genders, and backgrounds. While young adults and adolescents are at higher risk, anyone who is sexually active can contract chlamydia. It is important to recognize that chlamydia does not discriminate and can impact anyone, regardless of their socioeconomic status, race, or sexual orientation. Ongoing research is focused on developing a vaccine for chlamydia. Scientists are working to better understand the bacterium and the immune response it triggers, with the goal of creating a vaccine that can provide long-term protection against the infection. While a chlamydia vaccine is not yet available, advancements in research hold promise for the future. Collaboration among healthcare professionals, researchers, and public health organizations is essential for combating chlamydia. By working together, these groups can develop and implement effective prevention, diagnosis, and treatment strategies. Sharing knowledge and resources can help reduce the burden of chlamydia and improve health outcomes for individuals and communities. Support and counseling are important aspects of managing chlamydia. Individuals diagnosed with chlamydia may experience a range of emotions, including anxiety, shame, and fear. Providing emotional support and counseling can help patients cope with their diagnosis and encourage them to adhere to treatment and prevention measures. The long-term health impacts of untreated chlamydia can be severe. In addition to reproductive health complications, untreated chlamydia can increase the risk of acquiring other STIs, including HIV. The inflammation and tissue damage caused by chlamydia can create an environment that is more susceptible to other infections, further compromising an individual's health. Community outreach programs play a vital role in educating the public about STI prevention. These programs can provide valuable information and resources to help individuals protect themselves and their partners from chlamydia and other STIs. By reaching out to diverse communities and addressing cultural and social barriers, outreach programs can promote healthier behaviors and reduce the spread of infections. Understanding the life cycle of Chlamydia trachomatis is important for developing effective treatments and prevention strategies. The bacterium goes through several stages, including attachment to host cells, replication, and release of new infectious particles. Each stage presents unique challenges and opportunities for intervention, and ongoing research is focused on identifying targets for new therapies. Open communication with healthcare providers is essential for STI prevention. Patients should feel comfortable discussing their sexual health and any concerns they may have with their healthcare providers. This open dialogue can help identify potential risks, facilitate early diagnosis, and ensure appropriate treatment and prevention measures are in place. Social support networks can play a significant role in promoting sexual health. Friends and family members can provide encouragement and support for individuals to practice safe sex, get regular screenings, and seek medical attention if needed. Creating a supportive environment can help reduce the stigma associated with STIs and encourage healthier behaviors. Public health policies and initiatives can have a significant impact on STI rates. Policies that promote access to healthcare, comprehensive sex education, and STI prevention programs can help reduce the prevalence of chlamydia and other infections. Effective public health strategies require collaboration between government agencies, healthcare providers, and community organizations to address the complex factors that contribute to the spread of STIs. The global effort to combat chlamydia involves a multifaceted approach. International organizations, governments, and non-governmental organizations, NGOs, are working together to address the challenges posed by chlamydia. This includes funding research, implementing prevention programs, and providing resources for testing and treatment. By working together on a global scale, we can make significant progress in reducing the impact of chlamydia and improving public health. The future of chlamydia prevention and treatment holds promise. Advances in medical research, technology, and public health initiatives are paving the way for more effective strategies to combat this infection. Continued investment in research and innovation, along with a commitment to education and awareness, will be key to reducing the burden of chlamydia and protecting the health of individuals and communities worldwide. Together, we can fight chlamydia and protect our health by staying informed, practicing safe sex, getting regular screenings, and supporting public health initiatives. We can make a difference in the fight against chlamydia. Let's work together to create a healthier future for ourselves and our communities. Despite often being asymptomatic, recognizing the potential signs and symptoms of chlamydia is crucial for early detection and treatment. If you experience any unusual symptoms, seeking prompt medical attention is essential. In men, chlamydia may manifest as a burning sensation during urination, discharge from the penis, often clear or cloudy, and pain or swelling in the testicles. These symptoms typically appear within 1 to 3 weeks of infection, but can sometimes take longer. Women with chlamydia may experience abnormal vaginal discharge, often yellow or green, a burning sensation during urination, bleeding between periods, and pain during intercourse. Pelvic pain or lower abdominal pain can also occur. Fortunately, chlamydia is curable with appropriate antibiotic treatment. This means that with the right medical intervention, the infection can be completely eradicated from your body. The key to successful treatment lies in timely diagnosis and adherence to the prescribed medication regimen. When you visit your healthcare provider, they will assess your condition and determine the best course of action. This often involves a thorough examination and possibly some laboratory tests to confirm the presence of the infection. Once diagnosed, the next step is to discuss the treatment options available to you. Your healthcare provider will prescribe a course of antibiotics tailored to your specific needs, considering factors such as the severity of the infection and any potential drug allergies. This personalized approach ensures that the treatment is both effective and safe for you. The antibiotics commonly used to treat chlamydia include azithromycin and doxycycline. Azithromycin is usually given as a single dose, while doxycycline is taken over a week. Your doctor will choose the most suitable antibiotic based on your medical history and the specifics of your infection. It's important to follow their instructions carefully to achieve the best results. It's crucial to complete the entire course of antibiotics as prescribed, even if your symptoms improve before finishing the medication. Stopping the medication early can lead to incomplete eradication of the bacteria, which may cause the infection to persist or recur. Additionally, not completing the treatment can contribute to antibiotic resistance, making future infections harder to treat. Therefore, even if you start feeling better, continue taking the medication until the prescribed course is finished. This discipline in following the treatment plan is essential for your recovery and for preventing the spread of the infection to others. This helps ensure that the infection is fully eradicated and reduces the risk of complications or recurrence, When the bacteria are completely eliminated from your system, you can be confident that the infection won't come back. This not only protects your health, but also helps in preventing the transmission of chlamydia to your sexual partners. It's a crucial step in controlling the spread of this sexually transmitted infection. Moreover, completing the treatment as prescribed can prevent the development of more severe health issues that can arise from untreated chlamydia. While chlamydia is treatable, it's essential to understand that it can have long-term health consequences if left untreated. Ignoring the infection or delaying treatment can lead to serious complications that can affect your overall health and quality of life. For women, untreated chlamydia can cause pelvic inflammatory disease, PID, which is a severe condition that affects the reproductive organs. PID can result in chronic pelvic pain, which can be debilitating and affect daily activities. It can also lead to infertility, making it difficult or impossible to conceive children in the future. In some cases, PID can cause ectopic pregnancy, a life-threatening condition where a fertilized egg implants outside the uterus. Pelvic inflammatory disease in women is a serious complication that can lead to chronic pelvic pain, infertility, and ectopic pregnancy. Chronic pelvic pain can be a constant source of discomfort and can significantly impact a woman's quality of life. Infertility resulting from PID can be emotionally distressing for those who wish to have children. Ectopic pregnancy, on the other hand, is a medical emergency that requires immediate attention. It occurs when a fertilized egg implants outside the uterus, often in the fallopian tubes. This can cause severe pain and internal bleeding, and it can be life-threatening if not treated promptly. Therefore, preventing PID through early detection and treatment of chlamydia is crucial. Therefore, early detection and treatment are paramount. Regular screening for sexually transmitted infections, STIs, is essential, especially for sexually active individuals. Early detection allows for prompt treatment, which can prevent the development of complications and reduce the risk of transmission to others. If you suspect that you might have chlamydia or any other STI, don't hesitate to seek medical advice. Your healthcare provider can perform the necessary tests and provide appropriate treatment. Additionally, practicing safe sex by using condoms and having open communication with your sexual partners about STI testing can help in preventing the spread of infections. Remember, taking proactive steps to protect your sexual health is vital for your well-being and the well-being of your partners. Syphilis, a complex and potentially serious bacterial infection, is caused by the bacterium Treponema pallidum. This bacterium is a spirochete, which means it has a spiral shape that allows it to move in a corkscrew motion. This unique structure helps it to burrow into the tissues of the body, making it particularly adept at evading the immune system and establishing infection. Treponema pallidum is a delicate organism that cannot survive outside the human body for long, which is why it is primarily transmitted through direct contact with an infected person. This STD progresses through distinct stages, each with its own set of symptoms and potential complications. The stages of syphilis are classified as primary, secondary, latent, and tertiary. Each stage has unique characteristics and can present a variety of clinical manifestations. Understanding these stages is crucial for timely diagnosis and treatment. In the primary stage, the infection typically presents as a single sore, known as a chancre, at the site where the bacterium entered the body. This sore is usually firm, round, and painless, making it easy to overlook. If untreated, the infection progresses to the secondary stage, characterized by skin rashes and mucous membrane lesions. These rashes can appear on the palms of the hands and the soles of the feet, and they may be accompanied by other symptoms such as fever, swollen lymph nodes, and sore throat. The latent stage follows, during which the infection is not active but remains in the body. Without treatment, syphilis can progress to the tertiary stage, which can occur years or even decades after the initial infection. This stage can cause severe damage to the heart, brain, and other organs, leading to serious health complications and even death if left untreated. Syphilis can have devastating consequences, affecting the heart, brain, and other organs. The damage caused by tertiary syphilis can be irreversible, leading to conditions such as neurosyphilis, cardiovascular syphilis, and gumatosyphilis. Neurosyphilis occurs when the infection spreads to the nervous system, causing symptoms such as headaches, altered behavior, and difficulty coordinating muscle movements. Cardiovascular syphilis affects the heart and blood vessels, potentially leading to aneurysms and heart valve damage. Gumatosyphilis is characterized by the formation of soft tumor-like growths called gummas, which can develop on the skin, bones, and internal organs. The impact of syphilis on the heart, brain, and other organs underscores the importance of early detection and treatment. Early intervention can prevent the progression of the disease and reduce the risk of long-term complications. Treatment typically involves a course of antibiotics, such as penicillin, which is highly effective in eradicating the infection. However, the success of treatment depends on the stage of the disease and the promptness of medical intervention. Syphilis is spread through direct contact with a syphilis sore, known as a chancre, which typically appears in the primary stage of infection. These sores can occur on the external genitals, vagina, anus, rectum, lips, or mouth. The bacterium can also be transmitted from an infected mother to her baby during pregnancy or childbirth, leading to congenital syphilis. Congenital syphilis can cause severe health problems in newborns, including deformities, developmental delays, and even stillbirth. The primary stage of syphilis infection is marked by the appearance of a chancre, which is usually firm, round, and painless. This sore typically develops at the site where the bacterium entered the body, such as the genitals, anus, or mouth. The chancre may go unnoticed because it is painless and can heal on its own within a few weeks. However, the infection remains in the body and can progress to the secondary stage if not treated. These sores are usually painless but highly contagious. The presence of a chancre significantly increases the risk of transmitting the infection to sexual partners. It is important to seek medical attention if you notice any unusual sores or symptoms, as early diagnosis and treatment can prevent the spread of the infection and reduce the risk of complications. Syphilis is often called the great imitator because its symptoms can mimic those of other diseases, making diagnosis challenging. The rashes and lesions of secondary syphilis can resemble those of other skin conditions, such as psoriasis or eczema. Similarly, the neurological symptoms of tertiary syphilis can be mistaken for other neurological disorders, such as multiple sclerosis or Alzheimer's disease. This ability to mimic other conditions underscores the importance of considering syphilis in the differential diagnosis of various medical presentations. This underscores the importance of regular testing, especially for those who are at higher risk of infection. Regular screening can help detect syphilis in its early stages when it is most treatable. Testing is particularly important for pregnant women, as early detection and treatment can prevent congenital syphilis and protect the health of the baby. Regular testing is crucial for sexually active individuals, especially those with multiple partners or a new partner. Using protection such as condoms can reduce the risk of transmission, but it is not foolproof. Open communication with sexual partners about STD testing and sexual health is also important in preventing the spread of syphilis and other sexually transmitted infections. By staying informed and proactive about sexual health, individuals can protect themselves and their partners from the serious consequences of syphilis. Understanding the different stages of syphilis is crucial for recognizing the infection and seeking prompt medical attention. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. It progresses through several stages, each with distinct symptoms and potential complications. Early detection and treatment are essential to prevent long-term health issues. Each stage presents unique characteristics and potential health risks. If left untreated, syphilis can lead to severe health problems, affecting various organs and systems in the body. The infection can be transmitted through direct contact with a syphilitic sore during vaginal, anal, or oral sex. Pregnant women can also pass the infection to their unborn child, leading to congenital syphilis, which can cause severe deformities or even stillbirth. The primary stage of syphilis is characterized by the appearance of a chancre, a painless sore that typically develops at the site of infection. This sore is highly infectious and can appear anywhere on the body where the bacteria entered. The chancre usually appears about 3 weeks after exposure, but can range from 10 to 90 days. It is often firm, round, and painless, making it easy to overlook. Chancres can occur on the genitals, rectum, mouth, or other areas of the body. They are most commonly found on the external genitals in men and women, but they can also appear on the lips, inside the mouth, or in the anal area. Because the sores are painless, many people do not realize they have them, which contributes to the spread of the infection. They usually heal on their own within a few weeks, but the infection progresses without treatment. Even though the chancre heals, the bacteria remain in the body and continue to multiply. Without treatment, syphilis moves into the secondary stage, which can occur weeks to months after the initial infection. The secondary stage of syphilis typically manifests as a rash, which can appear anywhere on the body, including the palms of the hands and soles of the feet. This rash is often rough, red, or reddish-brown, and can be either faint or pronounced. It may cover large areas of the body or appear as a few scattered spots. The rash does not usually cause itching, which can make it less noticeable. Other symptoms may include fever, swollen lymph nodes, sore throat, and muscle aches. These symptoms can be mild and may come and go over time. Additional signs of secondary syphilis can include patchy hair loss, headaches, weight sheets loss, and fatigue. The symptoms of secondary syphilis are often mistaken for other illnesses, which can delay diagnosis and treatment. If syphilis is not treated during the primary or secondary stages, it can progress to the latent stage. During this stage, the infection is still present in the body, but there are no visible signs or symptoms. The latent stage can last for years, and without treatment, the infection can eventually progress to the tertiary stage. The tertiary stage of syphilis can occur years or even decades after the initial infection. This stage is characterized by severe medical problems that can affect the heart, brain, and other organs. Complications of tertiary syphilis can include gomas, soft, tumor-like growths, cardiovascular syphilis, and neurosyphilis, which can lead to paralysis, blindness, dementia, and even death. Early detection and treatment of syphilis are crucial to prevent these serious complications. Syphilis is easily curable in its early stages with a course of antibiotics, usually penicillin. Regular screening and prompt treatment are essential, especially for individuals at higher risk, such as those with multiple sexual partners or those who engage in unprotected sex. Preventive measures include practicing safe sex, using condoms, and having regular sexual health checkups. It is also important to communicate openly with sexual partners about STI testing and prevention. Pregnant women should be tested for syphilis during their prenatal care visits to prevent congenital syphilis. Public health efforts play a vital role in controlling the spread of syphilis. Education and awareness campaigns can help inform people about the risks of syphilis and the importance of getting tested and treated. Access to healthcare services, including STI testing and treatment, is essential for preventing and managing syphilis. Personal responsibility is also key in preventing the spread of syphilis. Individuals should take proactive steps to protect their sexual health and the health of their partners. This includes getting tested regularly, seeking prompt treatment if infected, and informing sexual partners about any potential exposure to STIs. In conclusion, understanding the different stages of syphilis and the potential complications is essential for recognizing the infection and seeking timely medical attention. Early detection and treatment can prevent serious health issues and help control the spread of this infection. By taking preventive measures and being responsible about sexual health, we can work together to reduce the impact of syphilis on individuals and communities. Fortunately, syphilis is treatable in its early stages with antibiotics. The discovery of antibiotics has been a game changer in the medical field, providing a reliable solution to bacterial infections that were once considered fatal. Syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum, can be effectively managed if caught early. The key to successful treatment lies in early detection and prompt medical intervention. When a patient is diagnosed with syphilis, the healthcare provider will typically prescribe a course of antibiotics to eradicate the infection. The type of antibiotic and the duration of treatment will depend on various factors, including the stage of the infection and the patient's overall health. Penicillin is the most effective antibiotic for treating syphilis, and the dosage and duration of treatment will depend on the stage and severity of the infection. Penicillin, discovered by Alexander Fleming in 1928, has been the cornerstone of syphilis treatment for decades. It works by inhibiting the growth of the bacteria, allowing the body's immune system to eliminate the infection. For early stage syphilis, a single injection of penicillin is often sufficient to cure the infection. However, for more advanced stages, multiple doses may be required over a longer period. It's important for patients to complete the entire course of antibiotics as prescribed, even if symptoms improve, to ensure that the infection is fully eradicated. Early diagnosis and treatment are crucial for preventing the progression of syphilis to its later stages, which can cause serious complications. Syphilis progresses through several stages, each with its own set of symptoms and potential complications. The primary stage is characterized by the appearance of a painless sore, known as a chancre, at the site of infection. If left untreated, the infection can progress to the secondary stage, which may involve skin rashes, mucous membrane lesions, and flu-like symptoms. The latent stage follows, during which the infection remains in the body without causing any noticeable symptoms. If syphilis is not treated during these stages, it can eventually progress to the tertiary stage, which can cause severe damage to various organs and systems in the body. Untreated syphilis can damage the heart, brain, nerves, eyes, and other organs, leading to long-term health problems. The complications of untreated syphilis can be devastating and irreversible. Cardiovascular syphilis can lead to aneurysms and inflammation of the aorta, the largest artery in the body. Neurosyphilis can cause a range of neurological problems, including headaches, seizures, and cognitive impairment. Ocular syphilis can result in vision loss and even blindness. The damage caused by tertiary syphilis can significantly impact a person's quality of life and may require extensive medical treatment to manage. Prevention is key in the fight against syphilis. Preventing syphilis involves a combination of public health strategies, education, and individual actions. Public health campaigns play a crucial role in raising awareness about the risks of syphilis and the importance of regular testing and safe sexual practices. Healthcare providers also play a vital role in prevention by offering testing and counseling services to at-risk populations. Education about the modes of transmission and the importance of early detection can empower individuals to take proactive steps to protect themselves and their partners. Practicing safe sex by using condoms consistently and correctly is crucial for reducing the risk of transmission. Condoms are highly effective in preventing the transmission of syphilis and other sexually transmitted infections when used correctly. It's important to use a new condom for each sexual encounter and to follow the instructions for proper use. In addition to using condoms, individuals can reduce their risk of syphilis by limiting their number of sexual partners and engaging in mutually monogamous relationships with partners who have tested negative for syphilis. Regular testing is also essential, especially for those who are sexually active with multiple partners or have a new partner. Regular testing allows for early detection and treatment of syphilis, reducing the risk of complications and preventing the spread of the infection to others. Healthcare providers recommend that sexually active individuals, particularly those with multiple partners or new partners, get tested for syphilis and other sexually transmitted infections at least once a year. Testing is a simple and confidential process that can be done at a healthcare provider's office, a sexual health clinic, or through at-home testing kits. By staying informed and taking proactive steps to protect their health, individuals can play a crucial role in the fight against syphilis. Regular testing for sexually transmitted diseases, including bacterial STDs like gonorrhea, chlamydia, and syphilis, is paramount for protecting your health and the well-being of your partner or partners. Early detection is crucial for effective treatment and preventing the spread of infection. Many STDs, particularly in their early stages, may not cause any noticeable symptoms. This means you could have an infection and unknowingly transmit it to others if you are not tested regularly. Talk to your healthcare provider about your sexual health and ask about STD testing. They can advise you on the appropriate tests based on your sexual history and individual risk factors. Remember, early detection is key to successful treatment and prevention. The importance of regular STD testing cannot be overstated. In today's world, where sexual health is a significant aspect of overall well-being, being proactive about your health is essential. Regular testing helps in identifying infections early, which can make a substantial difference in the treatment outcomes. For instance, bacterial STDs like gonorrhea, chlamydia, and syphilis can be effectively treated with antibiotics if detected early. However, if left untreated, these infections can lead to severe health complications, including infertility, chronic pain, and increased risk of acquiring other infections such as HIV. It's also important to understand that STDs do not discriminate. They can affect anyone, regardless of age, gender, or sexual orientation. Therefore, regular testing should be a routine part of your healthcare regimen, just like annual physical exams or dental checkups. By making STD testing a regular habit, you are taking a significant step towards maintaining your sexual health and overall well-being. According to the Centers for Disease Control and Prevention, CDC, there are approximately 20 million new STD infections in the United States each year. This staggering number highlights the prevalence of these infections and the critical need for regular testing. Early detection through regular testing can help reduce these numbers by ensuring that infections are treated promptly and effectively, thereby preventing their spread to others. There are various types of STD tests available, each designed to detect specific infections. Some tests involve a simple urine sample, while others may require a blood sample or a swab from the affected area. Your healthcare provider can guide you on the most appropriate tests based on your sexual history and risk factors. It's important to be open and honest with your healthcare provider about your sexual activity, as this information is crucial for determining the right tests for you. Receiving your test results can be a nerve-wracking experience, but it's important to remember that knowing your status is a positive step towards taking control of your health. If your test results are negative, you can breathe a sigh of relief and continue practicing safe sex to maintain your health. If your results are positive, your healthcare provider will discuss the next steps with you, including treatment options and ways to prevent transmitting the infection to others. Treatment for STDs varies depending on the type of infection. Bacterial infections like gonorrhea, chlamydia, and syphilis can typically be treated with antibiotics. It's crucial to complete the entire course of treatment, even if symptoms disappear, to ensure that the infection is fully eradicated. For viral infections like herpes and HIV, there are antiviral medications that can help manage the symptoms and reduce the risk of transmission. Your healthcare provider will work with you to develop a treatment plan that is tailored to your specific needs. In addition to treatment, your healthcare provider may also offer counseling on safe sex practices to help you reduce your risk of future infections. This can include information on the correct use of condoms, the importance of regular testing, and strategies for communicating with your partner or partners about sexual health. By taking these steps, you can protect yourself and others from the spread of STDs. It's also important to foster an open and supportive environment when discussing sexual health with your friends and partners. Stigma and shame can often prevent people from seeking the testing and treatment they need. By normalizing conversations about sexual health, we can create a culture where everyone feels comfortable taking charge of their health and well-being. The frequency of STD testing depends on various factors, including your age, sexual activity, and risk factors. The CDC recommends that sexually active women under the age of 25 get tested for chlamydia and gonorrhea annually. Men who have sex with men should get tested for syphilis, chlamydia, and gonorrhea at least once a year, and more frequently if they have multiple partners. Your healthcare provider can help you determine the best testing schedule for you based on your individual circumstances. When you go for an STD test, you may be asked to fill out a health questionnaire that includes questions about your sexual history and any symptoms you may be experiencing. This information is used to determine which tests are most appropriate for you. It's important to answer these questions honestly and accurately to ensure that you receive the best possible care. After your initial test, your healthcare provider may recommend follow-up testing to ensure that the infection has been fully treated or to monitor your health over time. It's important to keep these appointments and follow your provider's recommendations to maintain your sexual health. Regular STD testing is not just about detecting infections, it's also about taking a proactive approach to your overall health. By staying informed about your sexual health status, you can make better decisions about your health and well-being. This includes practicing safe sex, seeking treatment when necessary, and having open and honest conversations with your partners about sexual health. In conclusion, early detection through regular STD testing is key to maintaining your sexual health and the health of your partners. By making testing a regular part of your healthcare routine, you can protect yourself from the serious health complications associated with untreated STDs and contribute to the overall well-being of your community. Remember, taking charge of your sexual health is a positive and empowering step towards a healthier future. Receiving a diagnosis of a bacterial STD can be overwhelming, but it's essential to remember that these infections are treatable and manageable with appropriate medical care and support. If you have been diagnosed with a bacterial STD, follow your healthcare provider's instructions carefully and complete the entire course of antibiotics as prescribed. This will help ensure the infection is fully eradicated and reduce the risk of complications or reinfection. It's also crucial to inform your current and recent sexual partners about your diagnosis so they can get tested and treated if necessary. This helps break the cycle of transmission and protect the health of others. Bacterial STDs, including gonorrhea, chlamydia, and syphilis, are primarily spread through sexual contact. This includes vaginal, anal, and oral sex. These infections are caused by bacteria that are transmitted from an infected person to an uninfected person through direct contact with bodily fluids, such as semen, vaginal fluids, and blood. It's important to note that bacterial STDs cannot be spread through casual contact, such as hugging, kissing, sharing utensils, or using the same toilet. Preventing bacterial STDs is crucial for protecting your sexual health and the well-being of your partners. By adopting responsible practices, you can significantly reduce your risk of contracting and transmitting these infections. The most effective way to prevent bacterial STDs is to practice abstinence or be in a long-term mutually monogamous relationship with a partner who has tested negative for STDs. If you are sexually active, using condoms consistently and correctly every time you engage in sexual activity can greatly reduce your risk of contracting or transmitting bacterial STDs. Barrier methods, such as condoms, both male and female, play a crucial role in safe sex practices by providing a physical barrier that helps prevent the exchange of bodily fluids during sexual activity. Condoms, when used correctly and consistently, are highly effective in reducing the risk of transmitting bacterial STDs, including gonorrhea, Chlamydia and Syphilis. They act as a protective barrier, preventing direct contact with infected fluids. It's essential to use condoms correctly every time you engage in sexual activity to maximize their effectiveness. This includes using a new condom for each act of intercourse and ensuring it is properly applied and removed. Open and honest communication with your partners about sexual health is crucial for maintaining a healthy and safe sexual relationship. Talking openly about STDs, testing, and prevention strategies can help create a foundation of trust and respect. Before engaging in sexual activity with a new partner, have an open and non-judgmental conversation about your sexual histories and any previous STD testing. Encourage each other to get tested for STDs regularly, especially if you are sexually active with the multiple partners or have a new partner. Remember, open communication is key to a safe and fulfilling sexual relationship. Regular checkups with your healthcare provider are essential for maintaining your overall health, including your sexual health. These appointments provide an opportunity to discuss any concerns you may have, get tested for STDs, and receive personalized advice. During your checkup, be open and honest with your doctor about your sexual history, including the number of partners you have had and any previous STD diagnoses. Your doctor can advise you on the appropriate STD testing based on your individual risk factors and provide guidance on prevention strategies. Remember, regular checkups are your key to staying healthy and informed about your sexual health. Seeking help for sexual health concerns, including STDs, is crucial for your well-being. Unfortunately, stigma surrounding sexual health can prevent individuals from seeking timely medical attention. It's important to remember that STDs are common infections that can affect anyone, regardless of their background, lifestyle, or sexual orientation. There is no shame in seeking help for your sexual health. Your healthcare provider is there to provide confidential and non-judgmental care. They can answer your questions, provide testing and treatment, and offer support and guidance. Vaccinations play a crucial role in protecting individuals from certain STDs, particularly human papillomavirus (HPV) and hepatitis B. These vaccines are safe, effective, and can significantly reduce your risk of contracting these infections. The HPV vaccine protects against the types of HPV that are most commonly associated with cervical cancer, anal cancer, and other cancers. It is recommended for adolescents and young adults, both male and female. The hepatitis B vaccine protects against hepatitis B, a viral infection that can cause liver damage, cirrhosis, and liver cancer. It is recommended for all infants and children, as well as adults who have not been previously vaccinated. Gonorrhea, often referred to as the clap, is a highly contagious bacterial STD that can have serious health consequences if left untreated. Understanding the intricacies of this infection is crucial for effective prevention and management. The bacterium Neisseria gonorrhoeae, responsible for gonorrhea, thrives in warm, moist areas of the body, including the urethra, cervix, rectum, and throat. It can be transmitted through sexual contact, including vaginal, anal, and oral sex. Gonorrhea can also be passed from an infected mother to her baby during childbirth. This can lead to serious health problems for the newborn, including eye infections, pneumonia, and sepsis. Chlamydia, a common bacterial STD, can have a significant impact on reproductive health, particularly in women. Untreated chlamydia can lead to pelvic inflammatory disease, PID, a serious infection that can damage the reproductive organs. PID occurs when the bacteria that cause chlamydia spread from the cervix to the uterus, fallopian tubes, or ovaries. This can lead to inflammation, scarring, and blockage of the reproductive organs. In women, PID can cause chronic pelvic pain, infertility, and ectopic pregnancy, a life-threatening condition where a fertilized egg implants outside the uterus. Syphilis, a complex bacterial STD, has a long and storied history dating back centuries. The disease, caused by the bacterium Treponema pallidum, has been a significant public health issue for much of human history. Its impact has been felt across various cultures and societies, often leaving a trail of devastation in its wake. From the Renaissance to the modern era, syphilis has shaped medical practices, public health policies, and even social attitudes towards sexuality and disease. The journey of syphilis through history is a testament to the evolving understanding of infectious diseases and the continuous battle between humans and pathogens. Once a devastating epidemic, syphilis has re-emerged as a public health concern in recent years, highlighting the importance of continued awareness and prevention efforts. In the late 15th and early 16th centuries, syphilis spread rapidly across Europe, causing widespread panic and fear. The disease was often referred to as the Great Pox to distinguish it from smallpox, another deadly disease of the time. Public health campaigns have played a crucial role in educating the public about the risks of syphilis and the importance of safe sexual practices. These campaigns have evolved over the years, utilizing various media and communication strategies to reach diverse populations. In the past, syphilis was a feared and often fatal disease. The symptoms of syphilis can be severe and debilitating, affecting multiple organs and systems in the body. In its early stages, syphilis typically presents with a painless sore or ulcer at the site of infection, known as a chancre. If left untreated, the disease can progress to more advanced stages, causing a wide range of symptoms, including skin rashes, mucous membrane lesions, and systemic manifestations such as fever, fatigue, and muscle aches. In its late stages, syphilis can cause serious complications, including damage to the heart, brain, and other vital organs, leading to severe disability and even death. However, the discovery of penicillin in the early 20th century revolutionized syphilis treatment, making it highly curable with antibiotics. The introduction of penicillin marked a turning point in the fight against syphilis, transforming it from a deadly disease to a manageable and treatable condition. Penicillin, discovered by Alexander Fleming in 1928, was found to be highly effective against the bacterium that causes syphilis. The widespread use of penicillin in the mid-20th century led to a dramatic decline in syphilis rates, bringing hope to millions of people affected by the disease. This medical breakthrough underscored the importance of scientific research and innovation in combating infectious diseases. Despite the availability of effective treatment, syphilis rates have been rising in recent years, particularly among men who have sex with men, MSM. This resurgence of syphilis has been attributed to various factors, including changes in sexual behavior, decreased use of condoms, and the impact of social and economic determinants of health. The rise in syphilis rates among MSM highlights the need for targeted interventions and tailored prevention strategies to address the unique challenges faced by this population. Public health authorities and community organizations are working together to develop and implement comprehensive programs that promote safe sexual practices, regular testing, and timely treatment for syphilis and other sexually transmitted infections. This highlights the importance of ongoing education, prevention programs, and access to testing and treatment services. Education is a key component in the fight against syphilis, as it empowers individuals with the knowledge and skills needed to protect themselves and their partners. Prevention programs, including condom distribution, sexual health education, and community outreach, play a vital role in reducing the spread of syphilis. Access to testing and treatment services is also crucial, as early detection and prompt treatment can prevent the progression of the disease and reduce the risk of transmission. By investing in these efforts, we can work towards a future where syphilis is no longer a public health threat. The history of syphilis is a reflection of the broader history of medicine and public health. From the early days of the disease, when little was known about its cause or transmission, to the modern era of advanced diagnostics and effective treatments, the story of syphilis is one of scientific discovery and progress. Historical records and documents provide valuable insights into the challenges faced by past generations in their efforts to understand and control the disease. These records also highlight the social and cultural impact of syphilis as it influenced attitudes towards sexuality, morality, and public health. Today, research on syphilis continues to advance our understanding of the disease and inform public health strategies. Modern laboratory techniques, including molecular biology and genomics, have provided new insights into the biology of the syphilis bacterium and its interactions with the human host. These advances have led to the development of new diagnostic tools and treatment options, as well as a better understanding of the factors that contribute to the persistence and spread of syphilis. Ongoing research is essential to address the evolving challenges posed by syphilis and to develop innovative solutions for its prevention and control. Community health initiatives and outreach programs are critical components of the effort to combat syphilis. These programs aim to reach individuals and communities at higher risk of syphilis, providing education, testing, and treatment services in accessible and culturally appropriate ways. By engaging with community leaders, healthcare providers, and other stakeholders, these initiatives work to build trust and promote health equity. Outreach programs also play a key role in addressing the social determinants of health, They contribute to the spread of syphilis, such as poverty, stigma, and lack of access to health care. The fight against syphilis is a global effort, with countries around the world working together to eliminate the disease. International organizations such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, provide guidance and support for national and regional syphilis control programs. These efforts include surveillance, research, and the implementation of evidence-based interventions to reduce the burden of syphilis. Global collaboration is essential to address the challenges posed by syphilis and to achieve the goal of eliminating the disease as a public health threat. Personal stories of individuals affected by syphilis highlight the human impact of the disease and the importance of compassion and support. These stories provide a powerful reminder of the challenges faced by those living with syphilis and the resilience and strength they demonstrate in overcoming these challenges. By sharing their experiences, individuals affected by syphilis can help to raise awareness, reduce stigma, and inspire others to take action in the fight against the disease. Personal narratives also underscore the importance of providing comprehensive care and support services for those affected by syphilis, including mental health and social support. Looking ahead, the future of syphilis research and prevention holds promise for new breakthroughs and innovations. Advances in technology and science are paving the way for the development of new diagnostic tools, vaccines, and treatment options. Researchers are also exploring novel approaches to prevention, such as pre-exposure prophylaxis, PrEP, and other biomedical interventions. The integration of digital health technologies, including telemedicine and mobile health applications, has the potential to enhance access to care and improve health outcomes for individuals at risk of syphilis. By continuing to invest in research and innovation, we can work towards a future where syphilis is no longer a public health threat. Collaboration between healthcare providers, researchers, and communities is essential to the success of syphilis prevention and control efforts. By working together, these stakeholders can develop and implement comprehensive strategies that address the multifaceted nature of the disease. Healthcare providers play a critical role in diagnosing and treating syphilis, as well as providing education and support to patients. Researchers contribute to the understanding of the disease and the development of new tools and interventions. Communities provide valuable insights and support, helping to ensure that prevention and control efforts are culturally appropriate and effective. Through collaboration, we can achieve the goal of eliminating syphilis as a public health threat. In conclusion, the history and resurgence of syphilis underscore the importance of continued efforts in prevention, education, and research. While significant progress has been made in understanding and treating the disease, challenges remain. It is essential to maintain and strengthen public health initiatives, invest in research and innovation, and promote collaboration among all stakeholders. By doing so, we can work towards a future where syphilis is no longer a public health concern. Let us continue to raise awareness, support those affected by the disease, and take action to prevent its spread. Together, we can make a difference in the fight against syphilis. Antibiotic resistance, a growing global health threat, poses a significant challenge to the treatment of bacterial STDs, including gonorrhea, chlamydia, and syphilis. Overuse and misuse of antibiotics have led to the emergence of drug-resistant strains of bacteria, making these infections more difficult to treat. This highlights the importance of responsible antibiotic use and the need for new treatment options. Healthcare providers play a crucial role in combating antibiotic resistance by prescribing antibiotics appropriately and educating patients about the importance of completing the full course of treatment as directed. Beyond the physical health consequences, bacterial STDs can have a profound social and emotional impact on individuals, relationships, and communities. The stigma associated with STDs can lead to feelings of shame, guilt, fear, and isolation. This can strain relationships, affect intimacy, and create barriers to seeking health care and support. It's crucial to remember that STDs are common infections and that seeking help is a sign of strength and responsibility. Receiving an STD diagnosis can be overwhelming, but it's essential to remember that you can live a healthy and fulfilling life with the right support and resources. Your healthcare provider is your primary source of information and guidance. They can answer your questions, provide testing and treatment, and connect you with additional resources in your community. Support groups and online forums can provide a safe and confidential space to connect with others who understand what you're going through. Sharing experiences, information, and coping strategies can be empowering and help reduce feelings of isolation. Raising awareness about STDs and breaking down the stigma surrounding sexual health are crucial steps in combating these infections and promoting sexual well-being. Advocacy efforts focus on educating the public about STDs, promoting testing and prevention, and advocating for policies that support sexual health and access to care. By working together, we can create a more informed and supportive environment where individuals feel empowered to prioritize their sexual health without fear of judgment or discrimination. Your sexual health is an integral part of your overall well-being, and taking control of your sexual health is a powerful act of self-care. By prioritizing safe sex practices, regular testing, and open communication with your partner, you can make informed decisions that protect your health and the health of those you care about. Remember, your sexual health matters, and you deserve to feel empowered and confident in making choices that support your well-being. Knowledge is power, and by understanding STDs, their causes, symptoms, and prevention strategies, you are empowered to take charge of your sexual health. Prevention is key, and by adopting safe sex practices, such as using condoms consistently and correctly, you can significantly reduce your risk of contracting or transmitting STDs. Remember, your sexual health is your responsibility. By taking action to protect yourself and your partners, you contribute to a healthier and brighter future for everyone.